Okay, the patient's perineal area has been cleaned and assessed prior to the procedure, so I'll begin. Hi, my name is Mercedes Herbert. Today I will be your student nurse. Can I please have your name and date of birth? I would check that against the patient's armband. Now, do you have any specific allergies to latex, iodine, betadine, shellfish? No? Okay, today I will be inserting your Foley catheter. I will start by providing us with privacy and washing my hands. Okay. First, I will don clean gloves. And I would raise the bed to working height and pull down the side rails. Okay, and this seems to be working height. Now I would position the patient in the dorsal recumbent position. I would have the knees bent and feet together. Okay. Next, I would open my sterile package. And I would take out my pad. Shiny side down. Now I would remove my clean gloves and dispose of them in my red biohazard bag. Next, I will remove my sterile gloves. May I use you to apply my sterile gloves? And I would dispose of this. I will not be using my fenestrated drape on the patient. So now I will move my sterile field closer to the patient. Take out my lubricant and betadine, as well as my 10 milliliter syringe. Okay, I'll prepare my betadine swabs. As well as my lubricant. I would remove the plastic covering from my Foley catheter and attach my syringe. And with my non-dominant hand, I would open up the labia minora, making sure that it's not closed. And I would begin by cleaning the area, starting with the proximal and distal, and discarding in my red biohazard bag. And then finally the middle. From the clitoris to the anus, and disposing in my red biohazard bag. Next, I would lubricate my Foley catheter 2 to 3 inches, and I would begin by inserting my Foley catheter. Okay, I'm about to insert your Foley catheter. There should be little to no pain, but you may feel some pressure. I wouldn't touch any part. Okay. After I note urine, I would advance the Foley catheter 1 more inch. And then I would put the 10 milliliters. First, I would grab the Foley catheter to make sure that it doesn't move or slip out. Then I would insert the 10 milliliters of saline solution. Okay. And I would pull on it a little bit until I feel resistance. Okay, now I would remove my sterile gloves. Before I removed my sterile gloves, I would have detached my syringe, and I would discard of the syringe if this were a real patient, but because I will be using the syringe later, I'm going to set it off to the side. I would have had my sterile gloves on for this part. Okay, now I would tape my catheter to my patient's leg. Securely. And hang my catheter bag against the patient's bed. Next, I will apply clean gloves again. I would clean the betadine off of my patient. And dispose of it, as well as my other supplies. I would normally dispose of this, but because I need it later, I'll be placing this to the side. Next, I will be taking a sterile specimen of the patient's urine with the bag. I would remove it and open it. Being sure not to touch any part of it. Okay. Then I would close it and place it back. Okay. I would put my name and date on this and make sure it gets to the lab. My patient has been cleaned, so I would put my patient back into her original position. I would place my call light with my patient and I would raise the side rails and lower the patient's bed. Now I would remove my clean gloves, practice hand hygiene once again, and document. I would document the size of the catheter used, the reason for the catheter, the output and color of urine. I would document the amount of fluid of saline, which was 10 milliliters, and I would document patient tolerance. Okay. Next, I would gather my supplies for the removal of the Foley catheter. Gloves. Okay. Hi, my name is Mercedes Harbert. Today I will be your student nurse. Today I will be removing your Foley catheter. Could you provide me with your name and date of birth, please? I would check the patient's armband. Check the patient's armband. I would lower the side rails. I would raise the patient's bed to working height. Okay. Now first I will start by applying clean gloves. And using my pad for my patient once again. I would start by removing the tape from my patient's leg. disposing of that. Next, I would get my syringe. And make sure I get back 10 milliliters of saline solution because that's how much I placed into the patient. In which I would discard in my red biohazard bag. Next, I will tell the patient that I'm about to remove the Foley catheter. Again, there should be little to no pain, but you may feel pressure. I would grab a tissue in my non-dominant hand and begin removing the Foley catheter. I would put the tip of the Foley catheter in the tissue, and I would place the Foley catheter into the red biohazard bag temporarily. Okay. I would provide my patient with pericare, and I would remove my clean gloves and place my patient back into his or her original position, to hit her original position, sorry. I would raise the side rails and lower the patient's bed. Then I would apply gloves and remove the Foley catheter bag and take it to the bathroom to discard of the urine, as well as measure input and output for the patient. Okay. After I'm done with that, I could discard the bag, remove my soiled gloves, and place the call light with the patient, and practice hand hygiene once again. Lastly, I would document the patient. I would document if the Foley catheter was removed and intact. I would document the patient tolerance, the size, and if all 10 milliliters was removed from the patient.